instructions. Step 1. Washing and drying hands. Thoroughly wash and dry your hands and ask the patient to do so as well. Hands need to be properly cleaned prior to handling contact lenses, and you should emphasize the importance of this to the patient. You should then dry your hands with a lint-free towel to make sure there is no fluff left on them afterwards. Step 2. Preparing for contact lenses. Start by having the patient get familiarized with handling contact lenses. Take a lens out of the blister pack along with the patient, and be sure to check which eye the lens they have in their hand is intended for. It may be useful to encourage them to start with their dominant hand. To explain how to make sure the contact lens is the right way around or in the correct orientation, place the lens in the crease of your palm and curl your index finger towards the palm of your hand. If it is in the correct orientation, it will curl towards you or form a perfectly shaped bowl. If it is not in the correct orientation, the edges may flatten or flare out. If the lens they have been prescribed has a marking, you may want to show them how to find this to ensure the lenses are always the correct way around before applying. Another way of determining if the lens is in the correct orientation is to perform the taco test. After the lens is positioned on the cleaned index finger, squeeze the sides of the lens together. If it forms a perfect taco shell, it is in the correct orientation. If the sides of the lens flare out, it is not in the proper orientation. If necessary, freshen the lenses with solution after handling before beginning application. Step 3. Applying contact lenses. Check with the patient where they will most likely be applying the lenses when they're at home. You'll want to find out if they're likely to be looking down or straight ahead at a mirror, and start by replicating this as best as possible. If they'll be doing this in front of a sink, it may be useful to place a towel underneath just in case they drop the lens. Place the contact lens on the tip of the index finger of the dominant hand. Then, while looking in a mirror, using your non-dominant hand, lift your top eyelid with your middle finger close to where your lashes meet your eyelid. They may also wish to try using their thumb if necessary. Try to ensure all of the eyelashes are out of the way so they don't obstruct the lens from going in. If you find the first technique isn't suitable for the patient and they're struggling to apply the lenses onto their eye, no need to worry. Here's a different technique you can try. If the patient is not comfortable looking at themselves in the mirror as they apply the lenses, have the patient look down and towards their nose. Slowly apply the lens over the opposite side of the eye, the white portion of the eye closer to the ear. Have the patient look around the clock before closing their eyes to ensure the lens has fully grasped onto the front portion, the colored part, of the eye. Step 4. Check and confirm. Success! Your patient managed to apply their contact lenses for the first time. Once it's in place, you should ask the patient to move their hands away, keep their eyes open, and look around in different directions to help the lens adjust on the eye, and for any air bubbles to disappear from the lens. The lens should be and feel in place. It's quite common for their eye to be watering and for them to feel the lens at this point. Reassure them that this is very normal. It's just about allowing the eye to adjust to having the lens on it, and this will decrease with more frequent wear. While waiting for the lens to settle, it's worth talking to the patient about the next part of the journey. Remember, by the end of the contact lens teach, you will need to see the patient apply and remove their contact lenses at least 3 times before they can be signed off to take them home.